Welcome to our webinar this evening. I'm Kate from Fertility Network UK, and I'm joined this evening by Rachel Cutting from HFEA and Raj Mathur from the British Fertility Society, who are here to answer some of your questions. I wanted to thank everyone so much who sent in questions. We've been quite inundated with questions. I'm afraid we won't be able to include everyone's individual questions, but I hope that we're going to manage to cover most of the areas that you asked us to discuss. Rachel, I wanted to start by asking you something. We've heard from quite a few people who've been told that their treatment's being delayed again. And I wondered if you could start by explaining to us what the current situation is across the country with delays to treatment and clinic closures.
Yes, thank you, Kate. We do closely monitor this. What we do is we collect all the cycle numbers. So anybody having IVF or a frozen embryo transfer, that comes into the HFEA. And what we've done on a weekly basis is looked at how the sector is working and how many cycles are being done. And actually, it's been quite promising so far. Centres were able to recover quite quickly after they reopened in May. And certainly in December, there was actually more cycles carried out this year than there was last year in both the private and the NHS sector. So I think up to now, centres have coped very well. The latest lockdown and the latest wave has been more challenging there, and there has been obviously further pressures on the NHS. We've got over 100 centres that we regulate that provide treatments, and of those there's less than 10% who have had problems with their service delivery at the moment. So of the ones that have reported back to us, because every centre has to report back to us if they are changing what they're doing, there's a mixture there. So for example, one centre has had to stop all treatments completely, but is still doing urgent oncology patients. There's another centre who's just not doing IVF at the moment, but still doing FERs and IUIs. There's a couple of centres that aren't just starting new IVFs at the moment, but are continuing to see patients and work them up ready for that. And again, there's another centre, although they're suspending the IVF service, they're working in partnership with a local private centre so that they can prioritise the more urgent patients into that. We haven't heard of any other ones for the last week, so hopefully we're over the worst of the situation. And depending on how hospitalisation and pressures happen in the next few weeks, hopefully clinics will be able to remain open now. I think what I would encourage is for patients to look at the clinic's social media websites and look at them, phone the clinics and keep in touch with them. And obviously, if you have anxieties, that every clinic will have a counselling service that you can access to have a talk about it. Yeah.
Thanks, that's really quite heartening. I think one of the things that some people were worried about was that there might be another national closure of clinics like the one last year. Is there any possibility of that happening?
No, not at the moment. If we go back and think of the situation where we were in March, it's very different to where we are now. In March, there was a lot of unknowns. We didn't know what PPE and safe measures that we needed to put in place to be able to stop the virus transmission. Raj, who's here, who's chair of the British Fertility Society and the other professional bodies, put some very good guidance together, which was there to give clinics some guidance on how to operate safely during a pandemic. And from the HFEA, each centre had to develop their own treatment commencement strategy and send a really detailed documentation into the HFEA for the inspectors to show that they could prove that they could operate safely for patients and staff. So because of that, we're in a very different situations, and clinics have been really careful not to add extra pressure onto the NHS. We don't see at all as having to do another national shutdown.
Good. I'm sure a lot of people will be really pleased to hear that. Raj, I wondered if you could maybe explain to us, why is it that some clinics have had to shut down and not others? What is it that makes a difference? Raj, you're on mute at the moment.
Thank you. Well, different clinics have different challenges. So some clinics are part of large NHS trusts where their staff have had to be redeployed to support the effort against COVID, either staff who work in the clinic or staff who support the clinic, like anaesthetic staff. So a lot of the anaesthetists in our unit in St Mary's in Manchester, for instance, the consultants have had to be redeployed to intensive care. So we are unable to do anything that requires the presence of an anaesthetist. Now, that isn't necessarily true for all clinics. Either the COVID pressures in that trust are lower, or the clinics are entirely private, freestanding clinics, and they don't have to support other parts of the health service, so they're able to keep going. So I'm afraid it's a reflection of the fact that IVF clinics exist in a number of different settings with different pressures on them.
Thanks. Rachel, one of the things some people are worried about is actually how safe it is to have treatment. So we had a question from someone whose clinic said she can go ahead with treatment shortly, but she's really worried about the COVID risk actually going into a hospital. And she wondered what reassurance you can give that it is actually safe to do that at the moment.
As I just mentioned previously, what happened when centres were able to reopen from the 11th of May, they really had to review every bit of protocol and procedure that they had to make sure that there were safe procedures in place. A lot of what they developed was around the professional body guidance, which had drawn on the experts in the field who were working there. And they had to, each clinic had to submit a self-assessment questionnaire, which I think there was over 60 questions, and for each question they had to show how they proved they were doing something safely and how they were going to protect patients and staff. That was then reviewed by inspectors. If we weren't happy, we would ask for more information and we'd talk to the clinic staff. And we really had to be 100% satisfied that the clinic was operating safely to enable them to reopen. And then since that, obviously we're a long time along the road since May. Clinics have to report if they have any positive tests from staff or patients, any incidents, and we now are restarting inspecting, and part of those inspection process we're getting audits from clinics about how their cleanliness, what they're doing to check the COVID safety measures, how they've reviewed those procedures. So if for a clinic to be open, I would certainly be quite happy to go in a clinic at the moment, and so would the inspection team. So it shows that they are operating in a very safe environment, well, as safe as can be.
That's very reassuring, thank you. Raj, we had a question about testing positive for COVID when you'd actually started a cycle. So what happens if either you or your partner test positive during a cycle? And could a woman still have treatment if her partner was positive and she was negative? You're mute again, Raj.
Sorry, I'll crack this by the end of the pandemic. This can be a difficult situation where there are things to balance. Risks and benefits need to be balanced. I think the safest thing from all points of view is that if you are positive, if you've tested positive for COVID, you shouldn't be having fertility treatment until you're not infectious, both for your own health and for the sake of people around you, including the clinic and other patients. However, it happens, and it has happened in our clinic, that people start treatment and then they test positive. I think in that situation, I would certainly say that it is best not to have an embryo transfer. So to try and avoid pregnancy in that treatment cycle. However, it might be reasonable to go ahead and have an egg collection if that is what is planned, and then freeze all eggs or embryos. To some extent, this will depend on the stage of treatment that you're at. So it needs to be individualized with your clinic, depending on the situation that you're in exactly. And they should also take into account your own risk factors for various complications. I think if your partner has tested positive and you're due to have a surgical procedure such as an egg collection, then I think you should be considered very likely to be positive. Okay, but if there is time, you should certainly be swabbed, and you should certainly self-isolate from your partner until you've had your surgical procedure. That would be my approach to that.
Thank you. And is that pretty much what everyone else is doing as far as you know?
I think people are individualizing because of the different situations that patients present. We've had a patient, well, more than one patient, who's actually had a positive swab literally on the day of the trigger. So once the trigger has been administered, then we really have to have very good reason not to do an egg collection. So in most cases, we would have gone ahead, but then we wouldn't have done a fresh embryo transfer. We'd have frozen the embryos. There is a concern that if you test positive and you have a surgical procedure, And then if you develop the COVID illness, then that could be worse than if you hadn't had the surgical procedure. So we've got to weigh everything up, really.
Thanks. We've had another question from someone who's 39 and their NHS IVF has been delayed and has been told that the waiting list for treatment is going to be more than a year. Rachel, I wonder if you could explain what happens if someone gets past the NHS cut-off date age-wise for the time they get to treatment. Will they still be able to have treatment?
That must be very concerning for patients that don't know about their funding situation at the moment. And one of the problems is that there's such variability between the CCGs all around the country. And of course, each CCG will approach this situation very differently. The general guidance from the NHS is that patients really shouldn't be suffering because of delays due to the pandemic. So it may be that the individual clinics are already talking to the CCGs to see and work, to work around this problem and to see if either the extension can be given for funding, or it may be that if sometimes the CCGs hold contracts with multiple clinics, and it may be that the local private clinic, for example, may be able to, the funding might be able to be transferred to them. So I think whatever it is, it's vital that you speak to your clinic first, because whatever decision that you might make, you don't want to jeopardise losing your actual NHS funding. And of course, talk to the clinic that you're moving to make sure that you're happy to go there. But I do think it probably is a possibility that NHS funding can be transferred. I would just be careful about extra costs, and to make sure whichever clinic you're going to, you ask if there is any costs involved. Maybe you've got frozen embryos and there might be a cost of moving those, or a cost that you don't know even with an NHS funded cycle. So just make sure that you talk to the clinic you're moving from and to the clinic that you propose to go to, if it is possible.
So that could be a possibility, but it seems that it probably depends on where you live.
I think very much so, and it depends on the CCG. It's not always in the even if the clinic would like to do that for you, it's not in the clinic's powers, because it's the CCG who will make those decisions about funding.
And that's the clinical commissioning group.
Yes.
Raj, I wanted to ask you, and one thing that a lot of people are worried about with delays, it's not just the funding, it's also what kind of difference waiting will actually make to your chances of having a baby. And I think, last time around when it was maybe a month or two, people weren't quite so worried, but now having another lot of delays, I think a lot of people are getting really quite anxious about that. And I wondered if you could just explain to us a bit how much difference a few months or a year even of time does make to outcomes.
So I think in general, delay is bad for fertility. We always tell patients to not waste time if they want to try and conceive or if they want to have treatment. But it's important not to exaggerate it either. I think for most young women, by which I mean women younger than 35, delaying a few months or even a year is very unlikely to make a serious difference to your chances of conception. I think if you are 40 and above, then yes, even a few months might make a difference. And if you have a low ovarian reserve, then yes, even 3 months, 6 months might make a difference, unfortunately. That is true. There is some research from the United States where they actually looked at women whose treatment had been delayed due to the first wave of COVID in New York. And they actually didn't find a difference in the success rate between those patients who had been treated immediately and those who'd had a delay of 3 months or longer. So that was reassuring within certain limitations.
Thank you. Rachel, one other question we've had is about moving to the private sector. So some people whose treatment have been delayed in an NHS hospital, some of them have been thinking about moving to the private sector. If you do that as a patient, what impact does that have then on your NHS funding later on?
Well, certainly in normal times, in the CCGs, when I worked in the sector, that would have meant that you would have lost your NHS funding if you'd have privately funded the cycle yourself first. But of course, we are in very difficult and different times. So it may be that that's something that would be possible and a CCG would allow at the moment. But as I said earlier, it might be worth exploring if that funding could be transferred first if you really cannot access treatment and the delays, you know, are unacceptable, and it's a you're in a difficult circumstance where you cannot genuinely access treatment. So again, what I would recommend is firstly speak to the clinic that you're at the moment to try and ascertain how long the delay might be, and then ask whether funding can be transferred. And if it can't be transferred, then ask them to ask the CCG, if you do privately fund elsewhere, would that mean that you lose the funding? It's just important to get that information up front and before you make any decisions.
Thanks. We've had really loads and loads of questions about the COVID vaccine, and I think there seems to be quite a lot of misinformation out there about it. First of all, Rachel, I think some people have thought that perhaps the HFEA is setting guidance on when people should be vaccinated if they're having treatment. Is that correct?
It's not something that the HFEA would issue guidance on at all. You know, what we do is rely on the medical expertise of our colleagues, such as Raj in the BFS and the RCAG, to what we would do is obviously put their guidance on our website, and that would be reflected in the frequently asked questions, which is quite a useful part of the website for patients, but it's certainly nothing that the HFEA would make any rules or regulations about.
Thanks. Raj, I wanted to ask you a few questions about the vaccine, because I think this is obviously more your field. And a lot of patients have been really worried about whether they should have the vaccine if they're offered it. And we know that some kind of healthcare professionals and people are being offered it already. And people are asking, they've been told that initially that they should wait 3 months in between having the vaccine and getting pregnant, which, given the gap between doses, then makes a 6-month gap before you can really go on to treatment. But the rules or the guidance around that seems to have changed recently. And I wondered if you could just explain to us what the situation is now with the vaccine and treatment.
Thank you. Yes, you're right. There is a lot of confusion, let's say, about whether or not the vaccine should be taken or be administered to women who are having IVF or trying to have a baby and so on. So I think the first thing to understand is that the majority of medications that are used in everyday life have not actually been tested on pregnant women, because it's not usually part of the research trial. And usually in those research trials, women who might be pregnant are excluded, or if they are on the trial, they're asked not to conceive. And that is in general a principle that is used in testing new products. So the same applies to the COVID vaccines that are being tried. Having said that, there is experience of using some types of vaccines in pregnancy, and we know that they are safe. There is also the evidence we have from the biology of the vaccines, and we know that there's no conceivable mechanism whereby the vaccines could cause damage in this situation. So there are some reasons for us to be positive about it as well. You're absolutely right. The initial advice in the UK was that that if you had a vaccine, you shouldn't conceive for 3 months. That has changed. As of the 30th of December, the clear advice from the Joint Committee on Vaccines and Immunization is that if a woman has the COVID vaccine, she does not have to delay conceiving. So that bit seems fairly straightforward. I think if you're offered the COVID vaccine, then clearly the judgment has been made that you're at risk of getting COVID. And that risk is above the baseline level in the population. For instance, you might have an underlying medical problem, or you might work in a healthcare setting, for instance. So in that situation, there is a real risk if you didn't have the vaccine, and I think it is reasonable to have the vaccine. The problem may occur if you are pregnant when your second dose becomes due. And this might occur because, in general, doctors are a cautious bunch, and they might hesitate to vaccinate you if you are pregnant with your second dose. Now, you will already have some protection, of course, from the first dose. So getting the second dose might be an issue. The Royal College of Obstetricians and Gynecologists hasn't said that pregnant women should not get the vaccine, but they have said that each woman should have her particular situation, her clinical risks and vulnerabilities considered in making that decision. So I think there is understandably worry about it, but I would be broadly reassuring. I think if people are offered a vaccine, I think they should take it. I would also go further, and because there have been concerns, really quite unfortunate concerns voiced by people that the vaccine might actually damage fertility in men and women. And I think it's pretty clear from the biology of the vaccines that have been made that there is no theoretical basis to this. For instance, the Pfizer-BioNTech vaccine is what's called an mRNA vaccine against the spike protein of the virus. And there was an article which was circulated widely on the internet. By the way, it has now disappeared from the internet. So that is, please remember that. And that article said that that spike protein is very similar to a protein that is required for pregnancy. And therefore, if you had a vaccine against this, you might have a vaccine against pregnancy. So that unfortunately, that is actually completely untrue. The two proteins are very, very distinct. And the mRNA in the vaccine does not act against any pregnancy proteins. We also know that women who've had COVID, even during pregnancy, didn't have a very high risk of miscarriage, right? So clearly they produce the same antibody that the vaccine produces. And therefore we think that the vaccine is safe from that point of view as well.
So could I just clarify, how close to treatment would you think that someone would be fine to have the vaccine? Because obviously the problem at the moment is the two separate doses. So if you have one, then you've got this kind of time lags, and then someone could be pregnant when they need the second one. So what would you actually recommend your patients to do in terms of, how close to treatment would you have the first one?
So I think if you have the luxury of being able to wait 12 weeks, then you should complete your course before starting fertility treatment. But if you don't have the luxury, then I think it is okay to start fertility treatment after your first dose. And if you have a risk factor, then that needs to be taken into account in the decision to give you or not give you the vaccine if you were to conceive with treatment.
Because we did have one question from someone about being offered it actually during treatment and whether that would be safe. And I think what they were particularly worried about was the side effects that you can get from the vaccine itself, and whether that would be okay when you were having treatment. Would you advise people not to do that when they're actually in the middle of treatment?
I would advise that, having had the jab myself and having had not just a sore arm but a bit of a fever for a day or so. It's fairly common to get a low-grade temperature and to feel wrecked after the injection. So I would say it's probably best to avoid it during treatment, and also best not to start your other injections within a couple of days of the vaccine.
That's really helpful. Thank you. I think that's really clarified things a lot, because there has been a lot of confusion, I think, around the vaccine. I mean, if you had kind of a key message about it to people, what would you say?
I think this is a nasty disease. Do what you can to protect yourself. We are fortunate that we now have a vaccine. If you're asked to come for the vaccine because you fall into one of the high risk groups, I think you do yourself a service by having it rather than not.
Because there is some evidence, isn't there, that COVID itself could actually affect people's fertility. Is that right?
So fortunately, at the moment, there isn't a big impact on female fertility. There is some concern that if you actually got COVID at the time, your sperm parameters, sperm numbers, etc., might be slightly lower. But that doesn't also translate into lower male fertility as such, because you might have slightly lower sperm count. It might make no difference. It might only be a short-term effect. So it's not something. So we know that it's not present in the fluid around the eggs and the vaginal secretions, for instance. So in general, we're not that worried about the effect directly on fertility.
And thanks, it's really useful to clarify that as well. We did have one more question for you, Raj, about what people can actually do. Is there anything that they can do if they're planning to have treatment to keep themselves safe? I know some people have been isolating and things. What sort of advice would you have for people who are going to have treatment about keeping themselves safe?
I think the same principles apply across the board: hands, face, space. Keep your distance. Don't mix with people if you don't have to for work reasons. And I think ideally, if you're able to self-isolate during your treatment, then that is good. I don't want to make it obligatory or make too much of it, because I know people have to work, people have lives to live, and it isn't possible for everyone to self-isolate. Now, as a doctor doing fertility treatment, I would love my patients to be able to self-isolate and remain healthy throughout, but I know not everyone is able to do that. But if you can, please do. And certainly, I think in the week or so leading up to your egg collection, if you can achieve self-isolation at that time, that's a good idea.
Thanks. Rachel, I know that the kind of emotional impact of all of this has been huge on so many people, and it's a really tough time to be going through fertility problems, and at this particular moment in time during the pandemic. I think there's never been more of a need probably for counselling services, but are they still available? Can people still see the counsellor in their clinic during the pandemic?
Yes, definitely. That is part of a service that we always ask if make sure that clinics are providing, and we strongly encourage patients to access the counselling service. It will be done in a slightly different way in normal times because the counsellors are working remotely, so it will either be a phone consultation or a Skype or Teams or Zoom meeting. But I would, yes, strongly contact, for patients to contact clinics and talk through, even if it's just anxieties about having treatment at the moment or having the vaccine, or the worry about delays in treatments. But yes, I would strongly encourage you to actively phone the clinics and speak to the counsellors, because they are working as normal.
Thanks, that's really helpful. We do have a few questions. Are you all right if I just ask you some of these questions that we've got here? I'll just probably got time for a couple here. We've got a question saying, with the COVID pandemic now, what's the average time for a private clinic from the time you first engage with the clinic to when you're able to receive treatment? I wonder if, is that possible to say at all? No.
It's really hard to say. It depends on the clinic.
Yeah, it depends on the staffing resources, how big the clinic is. It would be a case of asking the clinic that directly, really.
We've got a very nice comment from someone here saying, I've had the vaccine already as I'm extremely vulnerable. It's just like the flu vaccine in terms of side effects. Sore arm, please get it. We all need to take responsibility and beat the pandemic together. And I think that's a very nice note on which to end. And I'm sorry that we haven't been able to answer everyone's questions that you've put during this time. Unfortunately, we had loads and loads of questions that people had asked us already, and we only have half an hour this evening. But I think maybe this is something that we'll try and do another time if people have more questions and things in the future, because I think it's useful to have updates from the regulator and from the British Fertility Society for patients. So thank you, Rachel, and thank you, Raj, so much for joining us this evening. It was really very much appreciated, and I hope that you've all found this information this evening useful. Thank you.
Thank you.
Thank you.